How do you know if a career in sexual well-being is for you? Hello, my name is Dr. Sara Nasserzadeh. I'm a psychosexual therapist and social psychologist. I've been working with couples and individuals around more than 41 countries now to this date. And the question that I often get is this career for me too? So, from younger people who are just entering the workforce or people who would like to redefine their career paths. So let's get to it, shall we? Let's see if I can help you to clarify your mind a little bit. First and foremost, I want you to think about why are you attracted to this field? Was it ignited in you all of a sudden based on a conversation, based on something you've seen, you've heard, you were inspired by? Why? Why now? So that's one. And you might actually say, well, all along in my life, I felt like I had this draw towards this field. And so just be clear. Is it inside you that you would like to heal? Is it a gap that you see within your community that you would like to fill? What is it? What is it that draws you to this field? That's one. The other thing is I wish for you to think about three main roles that you might be occupying, which could be compounded together and combined together later. But initially, you need to be very clear whether you would like to be an activist, advocate, or a practitioner in the field. What do I mean by that? By activists are people who have flashlights or torches, and then they go around and say, there's this issue here, there's this issue there. So they're steering the pot, so to speak. They're bringing things into light. They make it loud, they bring it to the awareness of people. And they're usually fueled by personal stories or personal reasons behind these actions that they're taking. That's activists. Advocate groups are the ones who go and say, you know what, here's the problem, and I'm going to bring resources and mobilize other people to come and pour resources and support into solving this issue, managing this issue. That's advocate. And then practitioners are the ones who are on a daily basis, they are client facing usually, and they get the job done. They create the solution, they come up with the strategies. And sometimes, as I mentioned, the line is a little bit blurred because all of us do all of that. But it's very important for you to know that what is it that you're doing first and foremost. What is that primary role for you? For me, for example, I would like to think of myself first and foremost as a practitioner who gets the job done on a daily basis. So I'm sitting on those tables, negotiating for access and putting the strategic plans in place or evaluating research for companies and organizations. And so these are the ones that you need to know about yourself: activist, advocate, or practitioner. So the other question I want you to ask yourself is, who do I want to belong to? Who do I want to belong to? Meaning, what group? Who are my peers? If I go somewhere and I introduce myself as a social psychologist, who are the other social psychologists in this community, in this group that I'm walking the line with, right? So that is important for you to know. Who are the peers? Who is my community? Who am I within that group? That's important. And then what are my initial needs and critical needs? For example, you can't be just thinking, well, you know what, I'm going to be an activist or an advocate or a practitioner in this field of sexual well-being without considering your socioeconomic and sociocultural context. Who is it that you're providing for? Is it only you financially and socially speaking that you're responsible for, or you're responsible for other people, elderly, children, your partner, your community that you're responsible for? So what is on stake, so to speak? If you can't bring the bread home, who is going to suffer financially? And if you are embarking in this journey socially, what are the implications for that? That's important as well. I've had people who really went into this field with all the passion in their heart, only to find out that their whole family was excluded from the community because this person specifically worked within the field of sexual health, or their parents, or even I have another example, maybe a more tangible example for you. They're teachers that they used to teach math, and then now they wanted to become a part of sexuality education program at school, and parents stopped hiring them as private tutors because they didn't want to do anything with a person who has anything to do with sexuality. So we need to really think a few steps ahead if we want to enter this field, because there is still taboo, there is still sensitivities and budget cuts around our field. So that's important for you to also to know about this. The other aspect I want to invite you to think about is your capacities. A lot of people in our field, including myself, we came in with a lot of passion for the field. But also, is that enough? Do you have what it takes to be in this field? You need a thick skin, let me tell you that. Because it's not that you're everywhere you go you're welcome. And also some people come to this field because they want to be the rebellions of the society. That's not that either, because if you keep steering the pot, if you are going to just raise issues and make things a little bit louder in the society, or be the rebellion in your community and in the field, sometimes it actually backfires, and it doesn't even only close the door for you, but also it closes the door for other people who want to follow you and follow suit in the career within that community as well. So it's important for you to realize that what is the capacity, again going back to what mobilizes you, why are you interested in this field and wanting to come in, and what are the resources that you have of time, energy, attention, and money to put behind your education and skill building, and where are you going with that? Let's say, for example, the clientele group that you would like to work with, the issues that you would like to solve. I always wanted to come to the field of sexuality because I like to work with relationships. And I figured that this is the most vulnerable place that people go. Although I ended up working with, I often say, from bedroom to boardroom, working with companies and leaders and United Nations and all of those international agencies, but I started from the sexuality piece because I figured the person in the bedroom is also the person who is showing up within the community, within in other relationships in their lives. So that was my reasoning to come into this, because I was interested in the relational dynamic, relational aspect of it, right? So you need to know what interests you. Also, be honest with yourself. What are you good at? Are you a good listener? Are you a good talker? Are you a good educator? Meaning that you can systematically think and offer people tangible solutions. Some people are better therapists than coaches. Some people are better coaches than educators. And again, I know that we all wear all of those hats in any given moment, and we can with proper training. But go after something that you specifically are good at. That will guarantee that you're more effective for your clients and your peer groups and community as well. I hope I answered some of the questions that you asked of me, that if this field is for you, the field of sexual well-being and sexual health, if it's for you. And in another video, I'm going to discuss what are the resources for each of these groups to go to and search around the educational resources that might be possible for you, certifications in different countries, and so on. Let me know what you think and how this was helpful for you. Also, feel free to send your questions. I love receiving them, and I will get to them as best as I can whenever I get a chance. Good luck with everything.